enough staff to cater for that edifice, and there is a need for primary health centers to rise to the occasion, so that every disease that came, whether as an outbreak or individually, can easily be addressed by primary health centers. And just last week, I think precisely on Thursday, President Bola Ahmed Tinubu had approved the distribution. Have approved the distribution of about 260 billion naira to primary health centers across the nation. Now it is the whole thing now rests on the onus of the Ministry for Primary Health to be able to utilize that particular funding that is likely to come to Niger State. And this is also where health-related NGOs need to also put their eyes on, so that they should be able to see when the fund finally arrives in Niger State, what it is being used for, and ensure that primary health centers across Niger State receive this funding so that people can receive quality services and primary health diseases can easily be nipped in the bud. At the moment, our children are already going to school, and many of these diseases are communicable. And diseases such as diarrhea and cholera are easily communicable, and children are already in school. So if you say, for example, you have a clean house, your child is looking very clean and he eats clean food, but he also mingles with children from other families. And these diseases are communicable. People also mingle in offices. People also mingle in buses. People also buy from the same stores and from the same shops, from the same markets. People touch the same items all over the place. Somebody opens a door of a commercial vehicle and went in or goes out, you also come in and open the same vehicle, and you use the same hand to touch what you eat. So the disease can be communicated through various instances. It is not ideal for someone to say that I live well, I eat very well, I live in a clean place, and hence I cannot be open to such kind of diseases. It can contact you from every possibilities. So people need to be much more careful. The government also need to rise to the occasion, especially the Ministry for Primary Health Care. They need to rise to the occasion to ensure that primary health centers are doing their best to address primary diseases. Malaria and typhoid now are the major diseases that are ravaging many of our children, including many families. Children are already missing schools because of typhoid, because of malaria, and so on and so forth. And in some states, cholera is already ravaging. In Lagos State, for example, about 30 people were said to have died in one day. So you can see that something that appears to be far away from us can reach us within a twinkle of an eye. Within 24 hours, it can be here. Because somebody can travel from Lagos to Niger State and can have either symptoms of the diseases, and the symptoms can break out as a disease when he arrived in Niger State.
So there is need for sensitization and surveillance,
of course,
coming from relevant
serious
authorities.
sensitizations and surveillance from primary health officials and even from family members. Everybody need to be on the alert.
So it's a collective
a collective responsibility now, not just for the primary health workers, but for even heads of families, and for everybody that has one thing or the other to do in terms of socialization in the society. Religious leaders, traditional leaders need to be hammering it on the pulpit, during sermons in churches and in mosques. People need to be sensitized. People need to be told that now is the season for these diseases, and the outbreak of disease is already here, and people need to be much more careful about those diseases. Is
it only the government that has responsibility when you talk about the issue of monitoring the disbursements of these funds to primary healthcare centers? We know that they have monitoring and evaluation unit or thereabout that usually supervise how these funds are being used. But we can't remove the hairy hands of corruption happening here and there. Even currently, in some primary healthcare centers, you find out that they're selling card for more than 100 naira for patients. And simple scanning and what have you, it is always, you either do it in the hospital if they have the equipment, or you go to private hospital where they will send you to. How can we mitigate this unfortunate incidents happening in our primary healthcare? Is it always the government? The government? Where are our philanthropic individuals?
No, the government can't do everything. And because the government can't do everything, I think apart from the fact that the government also want to bring health services to the doorstep of every Nigerian, one of the major reasons and ideas why the Babangida administration established primary health centers, I think, is to also enable philanthropic individuals living in communities to make contributions. And this is where individuals who are rich need to come in. In Niger State, we have a lot of people who are rich, who have been playing philanthropic services to primary health centers. I can afford to mention at least two. We have the Sardana of Mina. Yes, Ibrahim Aliu, the Sardana Mina. Of course, he has been doing that for so many years. He has supplied so many hospital equipments, including funding for primary health centers within Mina Tripoli. We have also General Abdesalami Abubakar, who also supply hospital equipments to primary health centers. These are the two philanthropic individuals that I can readily point at and even pinpoint some of the things that they have done in the past. And I believe that we have also other philanthropists who should also redirect their attention to primary health centers. Many of the primary health centers are in dire need of interventions, and the government can't do everything. Even though we know corruption is there, and corruption has always been a recurring decimal in public services in Niger State and in Nigeria in general. But there is also the need for corporate individuals, including corporate bodies like banks, like companies, to also come in and look at what they can do. I can still recall some years back, Fidelity Bank went to General Hospital Mina and did some interventions in some of their wards there. And I believe that if other banks can emulate what Fidelity Bank did some years back, it will also help. And I believe that other non-governmental organizations can equally come in. Even in terms of delivering monitoring services alone, that also is part of the philanthropic activities we're talking about here. It is not just about giving money, but also monitoring to ensure that when funding comes, they are judiciously utilized, and what ought to be purchased is purchased, and how it is being utilized as well. So all of this can help to improve the quality of services at primary health centers. And I believe that many of the primary health centers are capable of doing wonders if they have some of these equipment. I can still recall some of the primary health centers who have performed wonderfully very well in service delivery. I can readily pinpoint, for example, the what do you call it, the Gwari clinic there, behind stadium. That clinic, Asibiti Loco, they call it popularly. That primary health center at a point in time has even delivered a triplet, and it's a primary health center. So if a primary health center like the local hospital, primary health center, can deliver triplets, I believe that when given the desired support and equipment and motivation, they can perform wonders, and that will help to reduce the burden on General Hospital. So, I mean, if individuals, corporate bodies can come in and make a lot of donations and do so many other things that can help to improve the quality of services at primary health centers.
Okay, not forgetting the fact that in Niger State they have upgraded some hospitals, primary health care centers, to be general hospital, like the MI Ushishi General Hospital, even in some aspect, in some local governments. But the major problem they are facing is sometimes you find out that the doctors that will be assigned to this upgraded primary health care, being general hospital, you find out that they come in, let's say, twice in a week. So when you have serious cases, you have to transfer it to Mina or another hospital or even private hospital to take care of this.
Yes, that is one of the major challenges that we are facing today in Niger State. Many of the doctors that you are seeing there are even volunteers. And we've had mass exodus of doctors leaving Niger State to some other places in search of greener pastures. And those that you see are mostly volunteers who have decided to stay. And because of this, it is not easy to get a permanent resident doctor attached to a hospital because of the quantum of work, the quantum of attention that are needed from them. So hence they have to start moving from one hospital to another to deliver services. Some of them on daily basis, some of them have to skip days before they could go. If you have an operations to be performed in a particular hospital, the patient have to wait for the doctor who is equally performing operations in another hospital. So because of this, many people tend to patronize private hospitals. And then those who couldn't afford private bills, they have to wait until when the doctor is around. So you can see that the mass employment now of health workers in Niger State is coming at a very crucial time when their services are needed. But again, at every point in time when you are employing, you should also consider the fact that we also have Nigerites who are qualified doctors. And unless the number of Nigerites have been exhaustively employed, it is foolhardy for the government, for example, to simply overlook indigents and then go for non-indigents simply because they are medical doctors.
Have they applied?
Yes, quite a number of them have applied, but again, it is also
there are screening processes.
There are screening process for someone who have gone through medical studies and to medical school, did his housemanship and all of that. What qualification are you talking about again? And probably what you could talk about could be experience, and that can be garnered when he's employed and put under the tutelage of a more experienced doctors. And I believe that there are quite a number of Nigerites who are out there and wanted to work with the Niger State government and with the Ministry of Health. And I believe that if the government pays attention to many of our people, they will be willing to deliver services. But again, it will not. It is not the wisest idea to overlook Nigerites and go for non-indigents, especially in this aspect, because some of them went to school on scholarship paid by the government. After graduating, if the government is still overlooking them, then what the government has spent on them to study medicine will be a waste, because some of them will have to go to other states to become fully employed. And I believe that shouldn't be the way. If they have come back to work at home, they should be readily captured by the state government and be given job opportunities.
All right, 0901, that is 0903-880-8883 is the number to call in. Of course, make your comment, or you can post your comment on our Facebook page, Prestige FM Mina. Hello, good morning.
Hello, good morning, Madam Memuna. Hello, good morning.
Morning, sir. Who do I have on the line?
Dr. Vincent, good morning.
Morning, how are you?
Hi, sir. This is MD Awal from Kaku.
All right, MD Awal, make your comments briefly, please.
Always, I let you know on a daily basis.
Thank you. Thank you.
Dr. Vincent, we've been having a lot of setback in terms of health in Niger State. What I think, so you can see the lapses of preceding government having 2 or 3 doctors in general hospital, which is very, very unfortunate. You can see if you go to general hospital on a daily basis, find at least more than 1,500 or 2,000 patients waiting for a single doctor. You understand? To see doctor, you wait more than 3, 4, 5 hours to see the doctor. At times you even wait